Yeah, we are now live.
Assalamu alaikum and good evening, everyone. This is Syed Mohammed Shazib, Assistant Manager Marketing at HSEQ Professional. HSEQ Professional is a US-based firm having a head office in Texas and regional office in Saudi Arabia and Pakistan. We are a well-known company in the field of training, consultancy, and other technical services throughout the globe. A very warm welcome to all of you in this webinar, which is First Aid Requirements. This first stage requirements deal with the management system and getting demand in organizational sector who wants to improve themselves with the same international guidelines. Let's formally start the webinar. I would request to our senior trainer, Mr. Moat, please start the webinar.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. I'm glad to be here today with you to present this, inshallah, interactive and interactive webinar. So I will just focus on the first aid. What's the first aid requirement as per AHA, American Heart Association, and Saudi Heart Association. So my name is Muad Yahya. I have MBBS degree. I'm American Safety and Health Institute trainer and instructor trainer. And I'm glad to be here today. Thank you, HCQ Professional, for giving me this opportunity to be here today with you. So let's start the basic question. What is a first aid is? We usually, and every one of us at one point of time, we hear about first aid. But it seems we underestimate the importance of first aid. Okay, first aid is easy. Why we bother ourselves to learn first aid? But at the other side, actually, we are really focused on whatever it takes to improve our professional career. Any courses, whatever technical knowledge that we will help us to improve our professional career, we would love to take that. But sometimes those knowledge or those technical skills that is will be applied to just certain area in our job, and we won't take this technical knowledge outside of that office or that firm. But first aid, we don't need first aid just for work. First aid, uh, it's everywhere. We need this first aid anytime, anywhere. We didn't know when we need these skills. Uh, as I said earlier, we just say first aid is easy. Yes, I agree with you. First aid is easy in terms of the skills that we need to have, but it's really its importance. It's indescribable. Uh, so let's start by looking at what's actually the learning objective of first aid based on AHA or SHA requirement. Actually, this is the learning objective. So I won't go through all these objectives in this webinar, but I would love to explain or teach some of it. But it's good to mention the whole list of objectives at the beginning of this webinar. So the learning objective, the first one is how we can list the priorities, the role and responsibility of a first aid rescuers. Do you have priority in terms of applying first aid? What do you mean by priorities? Suppose we have many casualties. So which one to start with? How, based on what I can judge that I will start with this or that gentleman? Is it based on age? Or this seems senior guy, or this seem young guy, so I would start with the senior one or with the young? Is it based on racism? So this is black or this is white? Is this based on gender? How can I prioritize which one to help first? And, and what's my role? And what's my responsibility? Do I have responsibility about of applying first aid skills? So these kind of objective or question that would we, I mean, emphasize in a first aid course based on AHA and SHA regulation. Also, by the end of a first aid session, you need to describe what's the key steps in a first aid. And you need to know how to remove the protective gloves. What do you mean by protective gloves? Yes, because you need to have a BBE as a first aider before you help others. So in that matter, you need to know how to remove the protective equipment and gloves appropriately before you have helped a casualty. Also, how you can find the problem. Sometimes the emergency situation become confusing. You are uncertain. So how you can put yourself together to find the problem is. And also, you need to describe the assessment and the first aid action for the following life-threatening condition. So if you face a casualty has a heart attack, so how you can define at first he might have or she might have a heart attack. Difficulties breathing, how I can deal with the casualty with difficulty breathing. Okay, shocking. Shocking is not just for adult. We seems to have a shocking infant or shocking child. Even not just in home, in work, it might be in home with our beloved son and daughters. So how we can help our beloved one um, if they got shocking at any point of time. Also, severe bleeding. As a first aider, I need to know how to control severe bleeding. Shock. What do you mean by shock? Is it electrical shock or is it something else? And stroke. So this is a part of the objective in the first aid session. Also, as a first aider, after you get to first aid session, you need to know how to describe when and how to help a shocking adult or child, as I mentioned earlier, and how to demonstrate the even to infant. How you can control the bleeding and how to apply bandages. And to continue with learning objective, how you can recognize elements of common injuries or common illnesses. You need to describe how to find information on preventing illness and injury. Also, as a first aider, you need to recognize the legal questions that apply to first aid rescuers. Also, you need to describe and apply high quality CPR to improve survival. What do you mean by CPR? CPR goes for a short for cardiopulmonary resuscitation. Also, as a first aider, after you take a first aid session, you need to know how to demonstrate and use of an AED on adult. What an AED is? AED is a short for automated external defibrillator. So this is the learning objective that we need to be aware of after we enroll or take a first aid course. So in this webinar, I cannot go through all these objectives, but I would go through some of it. يعني to get يعني almost a general idea about first aid. Then you will get the necessary skills and every knowledge that needed to be a first aider in a real first aid course. So you need to prepare yourself to help. So accident and emergency happen, as I mentioned earlier, anywhere and anytime. So actually, even according to CDC Center, they mentioned this hundreds of million emergency departments visit for injuries and illness in the United States every year. So just basic safer practice at work, at home, and even we encourage this for our children to play safe to prevent many injury and illness and death, may God forbid. However, once an injury or sudden illness has occurred, effective first aid often improve recovery and even prevent permanent disability or death. Okay, so what's a first aid is? Basically, first aid is basically, first aid is the initial care when advanced care procedure are not really available. So what's the intent of a first aid? So a first aid intent to preserve life, alleviate suffering, prevent further illness or injury, and promote recovery. First aid can be initiated by anyone in any situation. Uh, Anyone in any situation. So a first aid provider is someone, yeah, you might ask, who's the first aid provider? So basically, first aid provider is someone trained to recognize, assess, and prioritize the need for first aid, provide appropriate first aid care, and recognize limitation. Also, it's part of your responsibility as a first aider to seek professional medical assistance when necessary. Um, okay, as a first aider, how would you recognize an emergency? Would you just go directly if anyone asks for help without recognizing is it an emergency situation exists or not? So you need to question yourself. So the question you need to ask about an emergency or any emergency situation: does the person appear to be unconscious? If you suspect an injury, how does it happen actually? And before helping as a trained first aid provider, you must be able to recognize that a medical emergency exists. As I mentioned, all often and always emergency situations are unexpected event and can be confusing. Yes, it can be confusing, but how we can minimize this confusion and be focused during an emergency? Actually, a general impression is a quick sense of what has occurred. Okay, we need to apply our general impression. What has occurred or what is occurring right now? This kind of general impression we need to apply when you first observe or you feel that an emergency scene is exists. So this impression can provide important clues to help guide you as you continue. So there is a question you need to ask yourself um, when you are in the emergency scene. So where is the person located? How is the person body positioned? Does the person look sick or injured? So let's go for the first question. Where is the person located? Is he home, office, or in the street? So if he's in the street, how is body positioned in the street? Anything around him, car, whatever. I mean, think maybe danger him, the casualty, or maybe danger for me as a first aider. Um, is a scene safe for me to be here? Is it safe or not? Whatever the situation is, you as an adult, you have the common sense, you have a general impression that you can really sense is it safe or not safe, whatever the situation is. And also, does the person appear to be unconscious or conscious? Actually, a person who is not moving and appear to have collapsed could have experienced a sudden cardiac arrest. It might be cardiac arrest, it might be other condition. Um, so that's you should or you could be the person only chance for survival for that casualty. So as I mentioned earlier, first aid is really easy, basic skills, doable skills, learnable, uh, but its outcomes, it's way better than, I mean, just basic skills that we apply. And you are a first aider, even though, as I mentioned, the first aid is really basic or easy skills to learn, your role is crucial as a first one in the train or in the chain of survival. You could be the only chance, the only chance for that person to survive is you as a first aider. So if you suspect an injury, how do you think it happened? Injury occurred due to physical force against the body. The manner in which that force creates an injury is called the mechanism of injury. So that's why we need house. Is he fell from down, or hit by a sharp object? Whatever the mechanism is, we need to just be aware of this kind of question, and be sure that um, recognizing the an emergency, you didn't need to think too much. You have just seconds to observe and think and to act. But here, while I'm explaining this, it seems it takes so long, but actually it's just a matter of seconds. Just think about what happened, what has occurred, what's occurring. Is it safe or not safe? Is it safe? You will proceed directly. Your personal safety. Your personal safety is most important thing, and this slide I would emphasize. I couldn't emphasize more actually. Your safety is really priority, because putting yourself in danger can make the situation even worse. What we get if you put your safety in danger? Usually, actually, emergency scenes are often and usually unsafe. So your personal safety is the highest priority, even before the safety of an ill or injured person. Because putting yourself in danger to help someone can make the situation worse, because you might be you are the only one with you are the only first aider there. If you put yourself in danger, so you put yourself, others, and bystander in danger as well, because other might following you, then they will put themselves in danger as well. So always, once you reach the emergency scene, pause for a moment, just for a moment, before approaching. Then look for any obvious hazard. You can see any obvious hazard? If yes, there is an obvious hazard. If you can do something to that, please make the scene safe, then approach. If you cannot if you cannot make the scene safe, it's out of your hand. Don't jeopardize yourself and put yourself in danger. And also, even if there is no obvious hazard, consider what's the possibility of hidden danger. You are approaching for, let's say, a car accident. You paused and you look around. You see you think that the scene is safe. Okay, there is no obvious hazard. Then you approach to the casualty. So consider what's the possibility of the hidden danger. Is it the car and fire or not? Is this a highway or not a highway? So did you assign or appointed someone to stop the cars coming to the scene? So this kind of thing, this hidden danger, we need to really be aware of and consider it as well. If the scene is unsafe, don't go in. Don't go in. Bottom line. And if you approach the scene, you feel that there is no obvious hazard. You say, okay, I will approach because there is no obvious hazard. But once you approach the scene and you are there and close to the casualty, and you felt or the scene suddenly become unsafe, get out. Your safety is priority. Also, about personal safety, there is another thing that we need to mention, that there is a PPE or personal protective equipment. Before helping any casualty, you need to take a protective measure to wear gloves, or if you have a face shield, that will have a good chance for you to protect yourself. Even though if the chance of getting any disease is small, even if it's 0.000001, if it's still there, it's a good idea always to take a proactive measures. Okay, how you decide actually to help? Deciding to help is not that easy, because, as I mentioned, emergency scene always unexpected. Out of the blue, you will hear someone, oh, someone died or someone injured. It's out of the blue. So deciding to help to be honest, it's one of the most difficult decisions to make, is whether or not to get involved when you think a medical emergency has occurred. It's normal. It's normal to feel that. Uh, Even though if you have an experience, even though if you have been, held hundreds of casualty, it's normal to feel hesitant about your ability to help. Why you feel that way? First, I think you might hesitate because you feel like the problem is too big to handle alone. But you can think other way. You are the only, you are only the first link. Remember that in the progressive chain of emergency care. Your involvement lasts only until relieved by other advanced first aid provider or responding EMS personnel arrive at the scene. In most cases, very short time. And don't think that it's too big for you to handle alone, because once you have a certificate that you are a first aider, that's mean you can help with those skills that you get out of that course. So don't underestimate yourself. You can do it. Other thing you might think and you might hesitate for fear of making things worse. Okay, I don't want to get involved because I might, instead of doing good, I will do things worse for this casualty. So to be honest, once you get the first aid training, actually that training provides you with sound knowledge and skills. That skills is designed only to help, not to harm those in need. Another thing that you might feel or to hesitate because you think you don't have a lot of medical knowledge. And to be fair with you, extensive medical knowledge is not necessary at all. First aid is simple and easy to provide, but the outcome of those simple and easy skills to apply, it's worthless. So, and finally, you might think that others around you might think that might take the charge. Actually, in fact, others may feel the same way, resulting in no one stepping forward to help. So you might feel think and the person behind you or in front of you or close to you or next to you think, okay, you might take a charge, resulting no one step forward to help. So that's why if it's safe, if the saying it's safe, please take action. Put whatever you learn in a first aid course or first aid program to work, and your action can help to protect and save a life. What a better than saving a life. So now I will get to a first skills that we always mention in first aid course. We call the primary survey. This is a primary survey. What's a primary survey is? Basically, primary survey systemic process of how to approach, how to identify, and how we deal with an immediate or life-threatening condition. So you might hear about primary survey in first aid, or you might hear that there is a secondary survey. Basically, primary survey, we are doing the survey with some kind of skills and approach that we are looking, is it there is immediate life-threatening condition or not? If there is life-threatening condition, we step immediately to forward to interfere, to apply our skills to control or save a life. And on the other hand, the secondary survey, okay, it's not an immediate life-threatening condition, but if left undealt with, it will harm the casualty and it might develop to be a life-threatening condition. So let's now talk about the primary survey. I have no time actually to go in depth for primary or nor in secondary survey, but actually I would like to mention what the primary survey is and how actually you can remember what's the steps you are taking in terms of getting primary survey complete. First of all, there is D, there is R, A, B, C, D. Why there is letter here in this slides? So DR goes for doctor. Let's suppose that we have someone named Dr. ABCD. Just remember this acronym, Dr. ABCD. So, okay, Dr. ABCD, but what does that mean? So let's see. Actually, D go for danger. As I mentioned, first of all, before you approach the scene, ensure that the scene is safe. Once you ensure that the scene is safe, there is no danger, then you can approach. So danger. If there is no danger, please go to the other steps. R response. If there is no danger, you are approaching to the casualty, and then you will check is he responsive or not. How you will check for response? Shoulder, hey, are you okay? Are you okay? If you know the casualty good name, just say whatever, Muhammad, Abdullah, Anas. Are you okay? Are you okay? If he's not responding, not responsive or unresponsive, you can go to for the next step. Airway. What do you mean by airway? We are intending to open the airway. How we can open the airway? As we call it, head tilt lift chin. Head tilt, that we are putting our head in the forehead of the casualty and two finger on the chin, and we just we will see the picture to even be more clear on this. And then we ensure is it the casualty breathing or not breathing. Then we go with the other step, C. C, it stands for call. So this is the time, a good time to call for an emergency medical services. So you have two options. Either you appointed someone, and don't just mention, please someone call emergency service, someone call emergency service. No, please, if you have someone that you know by name, mention his name. Please, Muhammad, call 911 or 997. Mention that. If you don't know, just some of you will say it's rude to point, but please, at this situation, point to anyone. Even though if you don't know his name or her name, point and mention, please call emergency service. And if you are alone, you can just get your phone out, dial the numbers 997 for Saudi Red Cross in Saudi Arabia, 911 even in Saudi Arabia, and whatever the emergency number worldwide. And if you do it yourself, just dial the number, put in the speaker, and put the phone is next to you, and start immediately for CPR. D, it goes for defibrillation, and here's the good time to use an AED. So for a first course, usually we will learn the basic first aid skills to apply, and also we will learn the CPR skills, the cardiopulmonary resuscitation skills, as well as we will learn how to apply an AED if one's available. So let's go in deep, just general information, not that deep. The airway, as I mentioned, this way we called head tilt chin lift method. We put, as you see, our hand on the forehead, then two finger on the chin, then we will tilt up. Is it clear now in the picture? So this is how we open the airway. So when we go to the airway, after we will check there is no danger, and if there is no response, then we'll go to open the airway. Then B breathing. So after we open the airway, we need to do the same thing here. As you can see in the picture that this gentle man, he's putting his side face to hear if there is breathing or not. So sometimes you will hear noisy gaps. In first few seconds or after a cardiac arrest, A casualty may be barely breathing or taking infrequent, slow, noisy gaps. Don't confuse with normal breathing. Normal breathing has no noise at all. It's just normal, effortless, simple breathing. If it's the casualty, it's barely taking breath, or there is noise or interferes and infrequent breathing. So that's mean it's not a normal breathing, and you need to prepare to start CPR. And after you open after opening the airway, look, listen, and feel. Look to the chest if there's chest rising or not. Listen if there's any breathing, any noise or not, and feel if there is any humidity that you may feel that's coming out of casualty. If the casualty is not breathing, so now we will go to the next step. For C, we will call the emergency service, either 997 or 911. And actually, it's really important how you call the emergency service. So once you call the emergency service, actually you need to be accurate in terms of providing the information. Don't actually talk too much. Don't just brief, okay, we have someone here, please come. No, introduce yourself. If you have, I mean, if you are first aider, خلاص, now you'll be first aider after you take a first aid program. Then introduce yourself. My name is such and such, and I'm a first aider, and I'm facing this kind of situation. And actually, even though if you take a first aid course and you are uncertain about anything, don't think that just the role of emergency services just as a call center, just to take our call and to send an ambulance to the scene. Okay, this is part of the role, but actually they have the role. They have a trained personnel that they can guide you through the phone. Whatever you need, just ask them. Okay, I am trained first aid provider, but actually I'm confused. I'm scary now. I'm not sure if what I'm doing now is really accurate or not. So they will guide you. Just don't be shy to ask for help. And actually, we're supposed to use that if the casualty not breathing, so commence or start CPR. So actually, we used to say that CPR we will do 30 compression, then to rescue breath. But nowadays, actually, with this COVID situation, we prefer not to do so. So the 30 compression will be just fine. And actually, we have this kind of module or method since 2015. We call it compression only CPR. That's if compression only CPR, anyone can apply, even if you are untrained or unable to rescue breath. If you are unable, whatever the cause is, but nowadays we have a valid cause to not do that, not to do a rescue breath, because compression only CPR will do just fine. So give chest compression only CPR. So this should continue at a rate of 100 to 120 compression per minute, and to a depth of 5 to 6 centimeters, just as a depth of a credit card. If you are unable, not trained, or unwilling to give rescue breath, as I mentioned, at any cause, and we have a valid cause these days, so just give a chest compression only. These should continue at a rate of 100 to 120 per minute, to a depth of 5 to 6 centimeter. And actually, if you know that you have an AED available around you anywhere, just ask anyone to bring it to you. Ask anyone, please call 997 or emergency medical service, and please bring an AED. In AED, we call it as the last D, defibrillation. So if an AED arrives, switch it on immediately. So nowadays, just within inshallah, coming maybe within 2 years, most of public places in Saudi Arabia will have an AED. Airports, whatever public place you think of, it might have an AED soon. So it's good to know about how to use an AED, how actually, what's an AED, what's its function. So I cannot go in depth in this short webinar, but actually we will discuss it deeply and why we use it, how to apply it, what's the benefit of it, what's the indication of using an AED, what's the contraindication of using an AED. This all things will be discussed deeply in a first aid program based on Saudi Heart Association and American Heart Association specification. And actually, AED is not used alone. It's actually used in conjunction with CPR. An AED machine, it's an fully automated that you just will follow visual or voice instruction, and it's easy to be applied. This will help because sometimes casualty will be unresponsive due to some heart issue disease. We call it arrhythmia. So this kind of arrhythmia will be as a result of even many diseases that I would rather not go in that details, but just for your information, this use to detect if there is any cardiac arrhythmia, this machine will know it, will analyze that rhythm, and the machine will advise you, is it good to have a shock or not? And you rule just to press that button and to ensure nobody is touching the casualty immediately, and you can press the button, and this machine, it will be helpful. It might be the matter of life and death.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Staying Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life.
So this is how we apply hands-only CPR. I would prefer to show the video again, so just for your information, and you can at any time just write in YouTube hands-only CPR and you will see this video. So let's see this video again. Let's watch it again.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Staying Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life.
So even though let's go for another topic. So in terms of how we control bleeding, wounds and bleeding, what type of bleeding that we have. So we have internal bleeding that we have no control over as a first aider, but we can identify that this casualty have internal bleeding, and we can be aware if at any time he has been unconscious, so we can interfere with CPR. External bleeding, it's really obvious whether it's venous bleeding or arterial bleeding. So actually this is where blood escape from the system and to outside of the body. It's really obvious, as you can see in this pictures. The standard method, so just remember this, please. The standard method of dealing or the standard way of controlling the bleeding, control any bleeding, is by applying direct pressure. By applying direct pressure. This is the standard way of control any type of bleeding. But in case if you found this the same that we have in this picture, this bleeding was as well as embedded object, glass, whatever it is, knives, and any sharp object. As you can see here in this picture that we have an embedded glass. If you apply this standard method by direct pressure, so we might do harm instead of do good for this casualty. And if you think just smart, and hopefully we don't think that way, okay, what if we just take out this embedded object? And this is the second gold rule. Never, ever, never take out any embedded object. But how we can stop the bleeding? So we can apply direct pressure without even pushing this inside or applying pressure on this on the embedded object directly. So as you can see here in the picture, we bring a roll gauze, we put it in both sides, and we apply pressure without even pushing this embedded object inside. And after we put both roll gauze in two sides, after we buried the embedded object between the two roll of gauze, then we can apply the bandage and apply more pressure and stop the bleeding. So this is actually one of the technique we use in stop the bleeding. I prefer to put this kind of scenarios because it's really tricky that we have embedded object and we have bleeding, how we can control it. So this is one of the technique that we use in terms of bleeding. We have many actually skills and many way how we can stop the bleeding. We can use tourniquet and how we use the tourniquet, how to apply the tourniquet. Also we have, we call it hemostatic bandage. This actually bandages have certain some sort of chemical materials that will enhance the clotting factor, and they will enhance they will enhance the process of bleeding control. This all of things also will be discussed deeply, thoroughly in a first aid program based on AHA and SHA specification. Also, we usually, and this one of the most common injury that we face, burn. So how we can deal with burn? Is the burn just one class, or we have some sort of classification? Actually, the severity of injury will depend on the classification of the burn. So there are three recognized classification of burn, either to be superficial burn, and we describe it as a first degree burn. How we can actually recognize or describe this type of burn as a first degree? As you can see here, it's just redness around the area. So if just redness, so then okay, we'll call it just a superficial burn, and we will describe it as or classify it as a first degree burn. If it's a partial thickness burn and there is redness, and also there is a sign of fluid-filled bubule or buster or whatever we can call it. If you see these things, so now we reach to the second degree burn. And if we reach to the full thickness that there is redness or redness, blackish or whitish around the area, so this we might reach to the third degree. Why we classify the skin based on first, second, and third? Actually, human skin is made up of three layers. The outer layers and the middle layers and the innermost layer. So if just the burn affect the outer layer, so we call the first degree burn. If the burn is affect the outer layer and the middle layer, so then we'll call it the second degree. That means the burn is reached up to the second layer of our skin. And if the burn reach till the innermost layer, then we will call it a third degree burn, which is the most serious one. The full thickness burn, the third degree burn, is the most serious type of burn. Although the full thickness burn, sometimes it won't be painful as first and second, but it's still the most serious or severe type of burn. Actually, we have more to cover. We cover some of PBE, but we have still more to cover. We have more to cover in terms of primary assessment. Secondary assessment, we didn't get in more depth in secondary assessment. Shocking, how we deal with a shocking adult, shocking child, or even shocking infant. How we should deal with fracture, dislocation. Is it serious? How actually we deal and how we should approach head and spinal injury casualty, how we should deal with major illness, heart attack, stroke, hypoglycemia, how we should deal with the seizing casualty. If anyone get poisoning, either inhaled poisoning or ingested poisoning, how we can deal or how we should apply our skills as a first aider to help that casualty, and more topic will be discussed in the coming first aid course. Thank you so much for paying attention. Thank you so much for your patience to reach to this point of the webinar. I really appreciate your passion to learn and to improve your personal skills and your professional career. Thank you so much. And if there is any question, I will be more than glad to answer.
Thank you so much, Mr. Mohad. Thank you so much for attending this webinar and taking the interest. Now it's time to ask your question with the trainer. You can write your question on YouTube chat column and WhatsApp group, as well as WhatsApp group. So please write your question on YouTube chat column on WhatsApp group. Then Mr. Mohad will answer your question. Please write your question on YouTube chat column.
So we have a question that how to handle any patient who is falling from height. As I mentioned that I didn't mention any the head and spinal injury technique and how we can handle the casualty falling from height. The basic approach is, as I mentioned in the primary survey, we actually ensure there is no danger for ourselves and for bystanders and others. And then we will try to approach and check if by tapping on the casualty shoulders, if there is any, if he responsive or not responsive. Then opening an airway and handling any casualties falling from height. So this is a major injury. We need to ensure that we are not doing a further harm to his backbone. So that's why there is a specific technique that we will actually emphasize and teach deeply and thoroughly in a first aid program. But however, if he unresponsive and he's not breathing, whatever is the mechanism of injury, we can move him and apply CPR. If he's not in his back, we can move him if he's not breathing. So there is some sort of exception. We don't intend to move any casualty that is falling from height to preserve any further injury for backbone, but sometime we need to handle him carefully and apply CPR if he's not breathing, because keeping the casualty alive is more important than keeping the backbone stable. So also we have another question. How should you open the airway of an unconscious casualty? As I mentioned, there is a head tilt, a shin lift. So we will put our hand, palm of our hand in the forehead of the casualty and two fingers underneath the chin. Then we will just lift slightly, and by that method we will open the airway. So also another good question, up to how much times we need to continue the CPR set. So actually we need to do CPR continuously, 30, then we'll continue 30, another 30, and till we reach 4 reasons to stop. We have no right to stop CPR once we begin doing CPR, unless we have one valid reason out of 4 condition that we can stop CPR. One, if the casualty become conscious or responsive, so we can now stop doing CPR. Secondly, if the advanced medical service arrived and they relieved me as a first aider, so then we can stop the CPR. The third reason when we should stop CPR, if the scene become unsafe, so I can stop the CPR and get out. And if I have time and I can move the casualty, there is a specific technique we will be teach in a first aid program, how we can move a casualty from the scene. And the fourth reason, if I got exhausted to the degree that I have no more power to continue. If I continue just one more cycle or one more compression, that I might faint next to him or next to the casualty. So at that time, I can stop. So hope this answered the question. This is the first reason when I should stop the CPR. CPR for child, we can do the same technique. So yes, the child and adult, the same technique, but the child, we won't be using 2 hands. You might be use 1 hand based on the child body build. But for infant, there is a different technique that also will be covered in a first aid program. There is a specific program for adult, first aid for adult, and there is first aid for a child and infant. What do we do in case of epilepsy or seizure? So actually, as a first aider, the only thing that we can do is just to make the scene safe for the casualty, because he might hit any sharp object. So we need to make the scene safe, to clean anything he might get in touch with. If you can put any pillow or cushion underneath his head, that would be good. some of the casualty while they seizing. So you can see some sort of forcing or fluid getting out of their mouth. So it's good if you see that to just move the casualty to be in his side till he finish the seizing period. Actually, some I mean mistakes that we are doing in dealing with seizing casualty. We intend to try to open the mouth. This is wrong technique. So we are doing nothing, but we try to make the scene safe. If he gets out, if he just has any sort of fluid from the mouth, at that time we can put him in the side. And if he continue to seize till 5 minutes and not stop, so at that time we should call for an emergency medical services. So actually there is يعني technical questions. So but I would read it, but actually I cannot actually brief it in 1 or 2 minutes. So there is some sort of technique, but I would read this question: how to evacuate to hospital, how to evacuate the patient in terms of cardiac arrest in offshore area without transportation. What should we do as a paramedic when we has done CPR? Uh, so actually, as I mentioned, yeah, CPR is not, I mean, it's not, I mean, aligned with how many minutes you will continue. CPR is you will continue forever till you reach this one of the 4 points I just mentioned earlier. And how you will deal with offshore area. So actually, there is an advanced first aid course that we can provide in this kind of settings. So I'm sorry, I cannot get in details of this question.
Thank you so much, Mr. Mohammed. Thank you so much, Mr. Mohammed, to giving
You
precious time to such a wonderful webinar. And now this time to exam. Once, thank you everyone for attending the webinar. We will now be sharing the exam link in the webinar group. You will have 15 minutes to solve this exam and submit it. Only top 10 candidates will be get free certificate with 100 marks and accurate time. If you will get 15% marks above in exam, so you can get the certificate of attendance with a minimum payment of USD equivalent. Good luck for exam and see you soon in the next webinar or training. Please provide your feedback on Facebook page and don't forget to subscribe our YouTube channel for more informative resource. Good night and thanks a lot, Mr. Mott.
You're welcome. Thank you. Good night to you all.